Have you started to feel anxious since your periods keep disappearing and the baby stork still hasn't shown up? Not to fret. We are excited to share exciting news with you. The number of things that can throw off one cycle is staggering, ranging from sudden changes in lifestyle to subtle hormonal imbalances. Having your period arrive late is one of the most stressful things that can happen to you. Pregnancy is most likely the cause, but there are other possibilities to consider as well. Number 8. Stress. Menstrual periods are just one aspect of women's health that can be negatively affected by stress. We all experience stress occasionally, but continuous stress or severe stress can disrupt hormonal imbalance and result in missed or irregular periods. Hormones like cortisol and adrenaline are produced in response to stress. The fight or flight reaction is triggered by these hormones to assist us in dealing with imminent danger. However, in today's fast-paced world, it is common for stress to remain continuous, resulting in the constant release of stress hormones. Prolonged exposure to stress hormones can disrupt the hormonal signals that set off and keep a woman's period on schedule. Ovulation is a crucial process that can be affected by stress. Ovulation, which is the process by which an egg is released from the ovary, is required for pregnancy. Consistently high levels of stress hormones can throw off the hormonal balance act necessary for ovulation to occur. Therefore, some women may have anovulatory cycles, whereby no eggs are released, resulting in skipped menstrual cycles. In extreme cases, stress can lead to amenorrhea. Amenorrhea is defined as the lack of menstruation for 3 or more consecutive cycles and has been linked to long-term stress. Amenorrhea may indicate a health problem that needs to be checked out by a doctor. Number 7. Weight fluctuations. Small fluctuations in weight can have a big impact on our hormones, which can cause missed or irregular periods because of the incredible complexity of the human body. Just picture this. You've been indulging in your go-to comfort foods a little too frequently, and the result is some unwanted weight gain. While it is fine to treat yourself every once in a while, doing so on a regular basis can throw off the hormone balance that regulates your period. Estrogen is an important member of the hormone ensemble. However, let us discuss unexpected weight reduction. Perhaps you've been on a rigorous diet or going through a tough time that made you lose weight quickly. Although a reduction in body fat is often a desirable health outcome, if it becomes too drastic, the body may interrupt it as an indication of impending energy crisis. When resources are few, the body may choose to preserve them by putting less emphasis on things, like maintaining a constant internal temperature or maintaining healthy organs. Non-essential functions such as menstruation may be temporarily suppressed or even shut down. People with eating disorders or who follow extremely restrictive diets are more likely to experience this occurrence. Ovaries are responsible for the majority of estrogen production. However, fat cells also contribute to this process. Weight gain, especially in the form of excess fat, causes an increase in the body's estrogen levels because of the increased number of fat cells. Period irregularity or absence may result from the disruption of the normal estrogen to progesterone ratio caused by excess estrogen. Number 6. Hormonal birth control. These contraceptives, which range from tablets to patches to injections and implants, have changed the way countless women around the world approach and implement family planning. Their primary function is to prevent conception, but they also have the potential to alter periods in interesting ways. Oral contraceptives, also known as birth control tablets, are an extremely popular form of hormonal birth control. These are hormone replacement therapy pills that contain estrogen and progestin in synthetic forms. Regular intake of these medications can help maintain stable hormone levels, which can lead to more regular and lighter periods. While hormonal methods of birth control have expanded women's reproductive freedom, they may also alter their menstrual cycles. Lighter periods, irregular bleeding, or even a complete absence of menstruation are all acceptable responses. However, it is crucial to see a doctor if they have any concerns or strange symptoms. Number 5. Thyroid problems. Despite its diminutive stature, the thyroid gland, located at the base of the front neck, plays a crucial role in maintaining health. This butterfly-shaped gland is crucial for maintaining the proper metabolic processes, energy production, and hormone balance. Thyroid abnormalities can cause a wide variety of symptoms, and women are more likely to develop thyroid disorders than males. When the thyroid gland stops producing sufficient thyroid hormones, a condition known as hypothyroidism develops. The symptoms of slow metabolism include weariness, weight gain, sensitivity to cold, dry skin, and erratic menstrual periods. Fertility and the capacity to conceive can be negatively affected by hypothyroidism, making it a major health problem for women. Correct diagnosis and treatment are essential for reestablishing normal thyroid hormone levels and enhancing general health. In contrast, hyperthyroidism is caused by an overabundance of thyroid hormone production. Weight loss, racing heart, anxiety, irritability, and irregular menstrual periods are some of the side effects of sped-up metabolism. Hyperthyroidism can affect fertility and should be treated as soon as possible to avoid future issues. Number 4. Intense exercise. Maintaining a healthy lifestyle requires striking a balance, which includes the importance of remaining active and partaking in regular workouts. Changes in hormone levels that control menstrual periods have been linked to intense exercise. Cortisol, generally known as a stress hormone, plays an important role in maintaining this equilibrium. When we work out intensely, our bodies release a flood of cortisol, which can interfere with the production of estrogen and progesterone, which are two hormones crucial to the menstrual cycle. This hormonal imbalance may result in menstrual dysfunction or even the absence of menstruation. Women who engage in sports like gymnastics or distance running that require them to maintain a low body weight may be at risk for a condition known as the female athlete triad syndrome. Eating disorders, lack of menstrual periods, and bone loss work together to cause this syndrome. The long-term effects of the trio on women's health and well-being can be devastating. Number 3. Perimenopause. Hormonal changes during perimenopause can cause a host of uncomfortable side effects in both the mind and the body. Symptoms can include PMS-like symptoms such as missed periods, hot flashes, night sweats, mood swings, vaginal dryness, low libido, and insomnia. Another possibility is alterations in menstrual flow, such as heavier or lighter periods. Ovaries generate the hormones estrogen and progesterone, which control a woman's menstrual cycle throughout her reproductive years. Ovulation and menstrual cycles become more erratic as estrogen production from the ovaries decreases during perimenopause. Hormonal changes during this period may cause a wide range of uncomfortable symptoms in women. The assumption that women will be sterile after perimenopause is widespread. Pregnancy is possible during this phase. However, the odds ratio is lower. Women with irregular ovulation may have difficulty estimating when they are most fertile, which can lead to unintended pregnancies. You should take highly efficient contraception until you reach menopause if you're not yet ready to start a family. Number 2. PCOS. Hormonal imbalances cause myriad symptoms associated with polycystic ovarian syndrome, PCOS, including infrequent periods, increased facial hair, hirsutism, acne, and weight gain. But the cysts in PCOS aren't the usual ovarian cysts you might identify with other medical diseases, so don't be alarmed by the name. Women with PCOS may worry about becoming pregnant because of the potential side effects of their condition. It can be difficult to conceive naturally if ovulation is irregular or absent. However, PCOS does not automatically rule out having children. Women with PCOS can have healthy pregnancies with the help of medical treatment and behavioral modifications. Number 1. Medication. Selective serotonin reuptake inhibitors, SSRIs, are a type of antidepressant that may upset the body's natural hormone balance. Menstrual irregularities, such as lack of periods, have been linked to hormonal imbalances. If you use antidepressants and have noticed changes in your menstrual cycle, please consult your doctor. They can modify existing pharmaceutical regimens or identify alternatives. Menstrual cycles can be affected by the corticosteroid medication used to treat inflammation, autoimmunity, and asthma. These drugs can alter hormone synthesis and inhibit the immune system. This might lead to missed periods or irregular menstrual cycles in women undergoing long-term corticosteroid therapy. If you are using corticosteroids and have seen changes in your menstrual cycle, it is important to discuss these with your doctor.